We begin with the latest coming in from the state of Maharashtra, where the state government has reconciled 1,522 COVID casualties, the highest in a single day, taking the overall death toll in the state up to over 1,03,000 COVID deaths. Since the reconciliation process began on the 17th of May, the state has added 11,617 COVID fatalities. Of these reconciled deaths, 8,404 were added in the first 10 days of June and 5,410 were added later. So these are the new figures of the COVID death toll in Maharashtra. In fact, just to give you a breakup of the reconciliated data, we have now figures that are coming in from multiple states as well. Thane, 573 deaths have been added. Similarly, in other centers, as you can see in those graphics playing in front of you, Beed 57, Yavatmal 57, Raigad, Kolhapur, Buldana, Sangli, Akola, Palghar, all these districts have their death toll revised. Let me go across to Mayuresh joining me on the phone line. Mayuresh, take the instance of Thane, 573 deaths added. Now, are we to believe that this was inadvertent or human error, or were there certain flaws in the system because of which the accurate figures of the death toll was not being recorded in these districts?
The sources within the state government, basically they're telling us this is not kind of a human error or something like that. But yes, the deaths were not reported on timely, and it's kind of a delay which had happened. And that's why when the state government got to know about this, and they immediately asked all the districts to reconcile their data and immediately update that data within 2 days in the given system. So state government, when we ask them that is it kind of an attempt from the state government to hide these data, because the number which is coming up is right now is more than 10,000 deaths. So the answer which we got it from our sources is that it's not the case of the state government is hiding it, but yes, there was a delay, and that's why they have been asked to immediately update the data within the 2 days.
Okay, so within the next 2 days, the figures must be updated in the record. So, Mayuresh, this is something we reported from Bihar as well. And in that case, it was because of the Patna High Court intervention that things came to light. What about in Maharashtra? How was the discrepancy detected?
Maharashtra was one of the first states which basically started the reconciliation of these dates from the first phase of the pandemic when they got to know. The sources also right now telling that in Maharashtra it is a regular process that after 15-20 days they do or they carry out this exercise of reconciliation. So it is not the case that the way which we are seeing right now of Bihar, where the High Court has to intervene. But in Maharashtra, from first wave only, or from the first phase of pandemic only, the reconciliation of deaths is happening.
Okay. So you're saying that this was done as part of the process, and the figures that were earlier reported are now being revised. What Mayuresh is telling us is that the process of reconciliation is part of the entire system. It is being done regularly, and from the first wave as well, this was being done. In fact, Mayuresh, if I can just ask you one last question around this, for the sake of our viewers who will have to understand why recording this mortality data is so critical, because, you know, based on this data, a lot of planning and strategizing is done, and world over, the data coming out of each country is watched closely, isn't it?
Right, but we have to see the back-end system also, because if we talk about the city like Mumbai or city like Pune or Nasik, there only you have a computerized system. But this data which usually comes is this data comes from the district level, where not everywhere the computerized system is there, and manually data gets recorded, and that's why there is a kind of a delay which happens. But let me tell our viewers that the right now the state government is reconciling the data of the hospitals, which includes the private hospitals from across the Maharashtra and government hospitals also. And as I said, that the state government is saying that this is a routine process, and they are conducting at every 15-20 days.
Okay, every 15-20 days, this is a process that is undertaken for reconciliation of the death toll figures. Vishwas Pathak of the BJP joining us on the phone line. Mr. Pathak, are you convinced with this? I mean, state after state are now doing audits, so it does seem like this is a part of the process that is done. But then, yes, we do see a big jump in the death toll figures in Maharashtra now after the revision.
See, not at all. I am not convinced. See, I recall our insistence by leader of opposition, Mr. Devendra Fadnavis. He has been always asking about the correctness of the death figures as well as COVID-affected patients and comorbidity patients. This government has always been adding those information and trying to show that they are very successful in handling COVID. Whether it was COVID-1 or COVID-2, Maharashtra and especially Mumbai was always ahead in terms of number of cases affected, number of beds having lots of problems, and also about these death cases. Most of the cases which were comorbidity cases were not shown as the COVID cases. They were shown differently. And Mr. Fadnavis has given one chart whereby other deaths in COVID-2 had gone up exponentially high. So I think this was a cover-up. And you may be aware that Maharashtra has got more than 1 lakh deaths, whereas the next state is Karnataka, which is 31,000. So I don't know what Maharashtra was trying to cover up by hiding this 10,000 plus cases.
The current death toll is 1,03,748 overall in Maharashtra after the reconciliation process that started on the 17th of May. But what are you trying to allude to, Mr. Pathak? Are you saying that these are systemic errors that have happened because some deaths are recorded, the cause of death is recorded as comorbidity instead of being recorded as COVID? But that would happen at the very doctor's level in a hospital, isn't it? How do you hold the state government responsible for it?
10,000, 11,000 days, it is a matter of error of commission or omission. All I'm trying to say that in COVID-2, deaths occurred due to COVID and deaths occurred for the reason other than COVID. This other than COVID, deaths have gone up exponentially high. So all I'm trying to say is this government and BMC has been always trying to cover up, show that they are performing well and dealing with this COVID very well.
That's an interesting point you're making, that going by the data that we have from previous years of deaths other than COVID compared to data this year, Mr. Vishwas Pathak is saying that number of deaths other than COVID this year is exponentially higher, which raises the suspicion on whether those cases are not being accurately reported. Thanks for joining us, Mr. Pathak.